There's no doubt that mental illness has affected the lives of millions of Americans, either directly or indirectly. Some of us have dealt with it in our own families or with friends. Others have been affected by terrible events like the high school shooting at Marjorie Stoneman Douglas. While the events can be very different, the underlying problem remains the same. When mental illness goes untreated, the results can be devastating. This presentation is about one tool that we as a society have to help people who may be experiencing a mental health problem. It's called the Baker Act. The Baker Act, officially the Florida Mental Health Act of 1971, made important revisions to mental health laws in Florida that had been in effect since the late 1800s. As you'll soon see, mental health care up until this point may have created as many problems as it did solutions. Before the Baker Act, if 3 people got together and accused you of being mentally ill, a judge could put you into a locked mental hospital with no limitations as to how long they could keep you there. Some people were kept for years on the agreement of just 3 untrained people, even without showing signs of any mental illness. Not only that, but the doctors in those hospitals could force medications on you, refuse your right to contact your family and friends, and even prevent you from calling the police if the employees of the facility beat you. Living conditions in many of those treatment centers were awful, and some people even died. There was one woman who stepped up and wanted to make changes to these dire conditions you see here. Maxine Baker was a state representative from Miami in the 1960s and early 70s. She had a strong interest in mental health issues and was the sponsor of a bill called the Florida Mental Health Act of 1971. Due to her tireless work in putting together new rules for how to treat individuals with mental health issues, the bill was informally named the Baker Act in her honor. The Baker Act granted many more rights, greater freedoms, and ensured much better care for individuals who were admitted to hospitals due to mental health concerns. There were many provisions in the act, and Maxine made sure that all individuals being admitted with mental health concerns were appointed a lawyer with whom they could communicate at any time, giving the ability to call and visit with friends and family, and treated with dignity and respect in accordance with their civil rights. She made sure of a few other things as well. She wrote the bill to ensure that people needing care were sent to a setting which was clinically appropriate, given treatment that was most likely to return the person to the community, guaranteed that their dignity and human rights were respected, and given the least restrictive means of intervention. All of these criteria and more are designed to ensure that programs and organizations are properly treating the people that they serve. Now that you have a basic understanding of what the Baker Act is, let's talk about how it works. The most common question I get about the Baker Act is, how does it work? The first thing to understand is that the Baker Act is not a punishment. It's a tool you can use when you're trying to get treatment for someone you care about and they don't think they need it or simply refuse to get help. So, when is it appropriate? The official guidelines basically say this: a Baker Act may be appropriate when there is reason to believe that the person has a mental illness, and without treatment, it is likely that they will suffer from neglect or they pose a threat to themselves or others, as evidenced by recent behavioral or verbal threats, and the person has refused voluntary examination and admission even after being explained the nature and purpose of it, or the person is unable to determine for him or herself whether examination is needed. So let's break that down for a minute. Reason to believe that a person has a mental illness. What this means is that there should be some evidence of something seriously being wrong with them, even when they are not drinking or using drugs. If, on a regular basis and while sober, the person seems off, such as demonstrating a form of odd behavior like appearing manic or hypomanic or psychotic, such as decreased reality testing, then they should get help. So, in a nutshell, it seems that it may be appropriate to Baker Act someone when something seems seriously wrong with them and you think that they might do something bad to themselves or someone else, and they don't want to go get an evaluation, or they just don't seem like they understand how bad off they are. It may be time to Baker Act them. So let's talk about who can do it. A Baker Act can be initiated by 5 types of professionals: physicians, including psychiatrists, but as well as other mental health professionals such as psychologists, licensed mental health counselors, licensed clinical social workers, and also police officers can initiate a Baker Act. Depending on the situation, you would contact one of these professionals. If the person is being aggressive or threatening to hurt themselves or someone else, you would likely call 911 to get help. Once the person is admitted, they're seen to get a physical examination, and we go over informed consent with them. If they're going to be admitted to the facility, they need that examination, and you explain informed consent, which means that you explain to the patient or to the guardian the reason for admission, the proposed treatment and its purpose, the potential benefits and risk involved, alternatives to proposed treatment, the approximate duration of treatment, potential consequences for stopping treatment, how treatment will be monitored, and that any consent given for treatment may be revoked orally or in writing before or during treatment. Now, a quick question. Does a family have to be notified when someone is Baker Acted? What do you guys think? The answer is yes. YES. The family should be contacted if someone is Baker Acted. Once Baker Acted and admitted, usually people will have a stay for 1 to 3 days depending on the situation. As stated before, they have a medical exam to check for medical reasons for their symptoms such as hyperthyroidism or diabetes. They'll be evaluated by a psychiatrist. Now, after their discharge, certain recommendations might be made. Once they leave the facility, we may recommend they have outpatient therapy, which means they're living back home but go once or twice per week to see a therapist, that they continue to take their prescribed medications to help stabilize their symptoms, and that they also have a fairly good diet or nutrition and some exercise recommendations, because those things are important as well. You may have seen some of my other information about prescribed medications and stigma because of the side effects of medications or the stigma of people being on meds. The Baker Act helps us, but it's not a perfect system. The last thing I want you to know is that it's far from a perfect system. Florida ranked 50th in terms of funding for mental health treatment, and incidences of Baker Acts have doubled over the past 15 years. Don't wait until it's too late to get your loved one help. Too often we don't take action until something terrible happens. We have to learn to recognize the signs that someone may need help and reach out to a professional for guidance. Share your concerns, listen to feedback, then take action. Do research if you need to. It can be difficult sometimes to find quality care, but the care is out there. And remember, doctors are people too. Sometimes we can make mistakes or be fooled by a manipulative patient or family member that goes with the territory of treatment. But you should educate yourself about how the system works, like you've done today in this video, and then you can increase your chances of having a positive outcome for you or your family member who you've contacted the system to help. Thank you so much for listening to this advisement. Please follow me on social media. I'm Dr. Delvena on Facebook and on Instagram, as well as Dr. Delvena on Twitter, and of course here on YouTube, Dr. Delvena Thomas. And please visit my website, drdelvena.help, HELP. And remember, guys, brain love.